Like 11, so
yeah. Okay, folks, we're going to get started in about 1 minute, just giving people a little bit of extra time to get in here in our virtual world. Can't see the chat. Okay, everyone, I know it's just a little bit after 1 o'clock, so I think that we will get started. My name is Fiona England, and I am the Healthy Mind Specialist with Winnipeg School Division. And we are so happy that you're all here to join us today. And we're also so happy to be able to be hosting the Manitoba Advocate for Children and Youth. Prior to getting started, I would like to introduce you all to the folks from the Manitoba Advocate. We have Acting Advocate Ainsley Krone with us. Ainsley joined MACY in 2009 as a special investigator on the Child Death Review Unit, where she blended research and writing skills to advocate for changes to public systems that could improve service delivery to families and prevent future deaths of children. From there, Ainsley went on to create and develop MACY's Communications and Research Department, successfully building and amplifying the voice of the office and running public outreach and education campaigns to increase awareness of the work of the advocate. This included partnering with the Canadian Mental Health Association in the creation of the Thrival Kits, which I think many of us now know very well and use, which is really, really great. In the spring of 2017, Ainsley was appointed the Deputy Manitoba Advocate, helping to organize and oversee ongoing initiatives, as well as the significant changes to the Advocate's expanded mandate under the new legislation. In January 2021, Ainsley was appointed Acting Manitoba Advocate for Children and Youth. Ainsley holds an MA in Communication with a specialization in international and intercultural communications and is a registered social worker with the Manitoba College of Social Workers. Ainsley's work focuses on children's rights, education, and finding creative ways to amplify the voices of young people. When not at work, Ainsley is surrounded by home and family, with her fingers deep in the dirt of her garden or happily grilling in her backyard barbecue. Oh, I really would like some backyard barbecue right now. Ainsley notes one of her biggest joys in life is spending time with her 13-year-old teen, who is one of the more hilarious little humans on the planet. Together, they are trying to teach their new puppy old tricks. Welcome, Ainsley. I'd also like to introduce everyone to Michelle Kowalchuk. Michelle started the Manitoba Advocate for Children and Youth in 2018 and is the program manager for the Advocacy and Youth Engagement programs. Prior to this, Michelle worked at the Healthy Child Manitoba office as the program policy consultant for Manitoba in the area of child and adolescent development. In this role, Michelle focused on developing policy, programs, and resources to support sexual health, suicide prevention, and mental health promotion, including a 1-year secondment to the Canadian Mental Health Association as their youth mental health coordinator. In the Healthy Child role, Michelle worked with many sectors, including education, health, justice, as well as community and Indigenous partners. Michelle also spent 19 years working in a clinical capacity, doing family mediation, family assessments, and counseling for children, youth, and their families experiencing separation and divorce. Michelle has taken a keen interest in children's rights and engaging children and youth to better understand their lived experience. Outside of work, Michelle enjoys hiking, skiing, skating, gardening, being with her family, and being an active part of the Ukrainian community. We're so happy to have you folks present with us and to be able to share all the amazing work of your office and to see how we could work together with MACY. And I'd like to just turn it over to you folks now. Thank you.
Awesome. Thank you so much, Fiona, for that introduction, for the welcome. It's really great to see so many people on the line with us today. We're really honored to be here and to share a bit of our afternoon with you to walk you through some of the information about our office. So as I get started, I want to acknowledge that the mandate of the Manitoba Advocate extends across the province that's now called Manitoba. So as an office, we therefore live and work on the original lands of the Anishinaabe, the Anishinaabe, Dakota Oyate, Denisulan, and Nehatuak. And that part of Manitoba is, of course, located on the beautiful homeland of the Red River Métis. Many of us are guests on this land, and we strive every day at our office to dedicate ourselves and the public resources that we're given to making meaningful contributions to the lives of all children and youth, but especially to the lives and experiences of First Nations, Métis, and Inuit youth in our province. We do this in a lot of different ways. We do it by listening to the voices and opinions of First Nations, Métis, and Inuit young people in our work, by ensuring that our staff team reflects the diversity of identities and families that we serve, by consulting with community members outside of our office, by working in collaboration with the diversity of Indigenous peoples who live here, and overall, by ensuring that our office embraces and that our work reflects a philosophy of continual learning and growing in a spirit of reconciliation and collaboration. So our office has recently released a framework and a work plan for reconciliation, and you can find that on our website. And I think Jessica, who's our manager of public education, who's on the line with us today, she's going to be adding the link to our reconciliation framework to the chat function, so you can feel free to check it out there. This is a document that we have released to the public as part of our commitment and our statement of organizational accountability. And we always invite anyone to provide feedback to our office about what that framework describes and contains. And you can either send us an email after you review it with your thoughts, or you can always find a link to the reconciliation feedback survey on our website as well. So here's what we plan to cover today in our presentation about the Manitoba Advocate for Children and Youth Office. And I think Jessica's just going to flip to the next slide. There we go. Thank you. And if you could go to the next slide, please. Thank you. So what we're going to do is we're going to talk to you about the United Nations Convention on the Rights of the Child, which is also known as the UNCRC, which guides all of our work. We're going to tell you how our office came to be and how our mandate has changed and evolved over the nearly 30 years that we've been in existence. And in that vein, we're going to talk to you about the Advocate for Children and Youth Act, which is also known as the ACYA, which helped expand our mandate considerably in 2018. We're going to discuss the role of the Manitoba Advocate for Children and Youth, which is also known as MACY. And we're going to talk to you about how we advocate on behalf of children and empower people to do their own advocacy. And so at that point in the presentation, I'm going to turn things over to Michelle, who, as you heard, is our manager of advocacy services and youth engagement. And Michelle's going to touch on some case examples, including stories that we've heard about in our advocacy services program, in particular during the COVID-19 pandemic. So then we'll be talking about some of the other teams and some of the other work that we do at MACY in addition to advocacy services. And so that's going to lead into some discussion about some of our special reports and recommendations that we've made specifically in the education sector. And then last, we're going to wrap up by sharing our contact information, and we're going to have time for questions and answers at the end. So if you do have something that you want to ask throughout the presentation and you don't want to forget, you can feel free to put that in the chat box as we go along, and we'll get to those questions at the end. There'll be time for you to either unmute yourself and ask questions at that point, or we can ask the ones or just answer the ones that are in the chat function. So let's talk about the United Nations Convention on the Rights of the Child. So the UNCRC is a cornerstone document that guides all of our work at the office. Under our legislation, the ACYA, our office holds a legal responsibility to promote awareness and understanding of children's rights. And among other criteria, we use the 42 key articles of the UNCRC as guides when we assess situations regarding the availability and the quality of public services for children. As you might know, Canada signed on to the UNCRC in 1991. It outlines all of the rights everyone under the age of 18 has, including the rights to live in a safe environment, to be protected from discrimination, to have quality education, food, clean water, and more. And so the federal government was the signatory to that document, to the UNCRC, and promised at that point to protect and uphold these rights for all Canadian children. And the Manitoba government, therefore, has a duty to uphold those rights as well. So we have a lot of resources that we put out to the public that, that describe and promote the UNCRC and the articles inside that convention. We have posters, for example, that you're seeing up on your screen right now that we've designed in youth-friendly language, which you can ask us for, or you can easily find those on our website. And you can get those at manitobaadvocate.ca. And I think that Jessica's probably going to put a link for our website into the chat. So the posters that we have available for the public are available in multiple languages, including English, French, Cree, Ojibwe, Oji-Cree, Michif, Tagalog, and also in Braille. So there's a couple of other key documents that we often refer to in our work, and those include the United Nations Declaration on the Rights of Indigenous People, the Truth and Reconciliation Commission's calls to action, and the calls to justice from the Missing and Murdered Indigenous Women and Girls Inquiry Report. In our work throughout Manitoba, we strive to walk the path of reconciliation, and we work individually and as a team to understand and implement the work of the TRC. We try to embed cultural awareness, cultural safety, and anti-racism within all of the work that we do on behalf of children, youth, and their families. And so then in terms of legislation, there are multiple acts that we refer to, but we often will, some of our key documents that we'll reference include the Youth Criminal Justice Act, the Child and Family Services Act, plus of course, the Advocate for Children and Youth Act guides all of our work and lays out our legal mandate to stand up for children, youth, and young adults across Manitoba. So I want to tell you a little bit about the history of our office and how our legislation, the Advocate for Children and Youth Act, came into effect. In 1985, some of you might recall that there was a landmark report that's informally known as the Kimmelman Report, which reviewed the adoption practices with respect to First Nations and Métis children in Manitoba, which is often known as the 60s Scoop. Judge Kimmelman's report was highly critical of the government's practice of adopting Indigenous children out to non-Indigenous families, often outside of the province and often outside of the country. In the report, Kimmelman made more than 100 recommendations, including his call for a child protector office to be opened to offer children who were in foster care support and guidance. So that particular recommendation led 8 years later to the creation of the Office of the Children's Advocate, or the OCA, which is what we used to be called and which opened in 1993. And for all of you math teachers on the line, you'll know then that next year our office is going to be marking our 30th anniversary. So at first, the legislation under which the Children's Advocate received its legal mandate was embedded inside the Child and Family Services Act, or the CFSA, which meant that in the early years of our office, the Children's Advocate reported directly to the Minister of Family Services inside the provincial government. But in 1999, a legislative review of our office occurred, and it was determined that the Children's Advocate really needed to be independent and exist outside of the government structure, so that the advocate could speak freely about concerns on behalf of children. So in 1999, our office became an independent office of the Legislative Assembly, very similar to the Ombudsman's Office or the Auditor General. And the advocate at that time ceased reporting directly to any government minister. But the challenge was that the legislation that described the advocate's legal mandate remained embedded within the Child and Family Services Act, and our scope, therefore, continued to be narrowly focused on the child welfare and adoption systems. And then in 2008, the Children's Advocate mandate grew when the responsibility for child death reviews was transferred from the Office of the Chief Medical Examiner to the Office of the Children's Advocate. And so this means that anytime a young person under the age of 21 dies in our province, the Manitoba Advocate is officially notified by the Office of the Chief Medical Examiner. So after 2008, there was increased discussion about the need for true independent legislation for the advocate in Manitoba, which is the direction that many other child and youth advocate offices in Canada were moving. And then in 2014, many of you will recall that the Honorable Ted Hughes released the final report of the Phoenix Sinclair inquiry. And what's important to note about that inquiry report for our perspective is that 20% of the final recommendations of that inquiry were aimed at broadening and strengthening the role and mandate of the children's advocate, including Commissioner Hughes' call for standalone legislation for the advocate. So then a few years later, by 2017, the Advocate for Children and Youth Act was introduced, and it actually received rare unanimous support from all three political parties in the provincial legislature. In March 2018, the Advocate for Children and Youth Act finally came into force, which significantly expanded our ability to provide advocacy services and system oversight to areas of the public service. And those include child and family, adoptions, which had always been in our scope, but what was added in 2018 included education, mental health, addictions, disabilities, youth justice, and victim supports, which includes domestic violence and sexual exploitation. So then just last year, in June 2021, our mandate expanded again when additional public services, including child welfare, mental health, addictions, and youth justice, became formally reviewable by our office in the event of a serious injury or the death of a child, youth, or young adult. But there's one area of our legislation that was proclaimed back in 2018, but still remains held back by the government from coming into force. And that is the pending requirement for public services and regional health authorities to report serious injuries of children and youth to the attention of the Manitoba Advocate. Right now, as the Manitoba Advocate, I can investigate serious injuries that come to my attention, but without a requirement for systems to report those to us, we're only aware really of a small number of injuries happening in our province to young people. Reports of serious injuries right now come to our office informally from the community. Sometimes they'll come from a concerned community member bringing it to our attention, and often we learn of serious injuries when media contact us to inform us of the incident. Investigations of serious injuries is a very important outstanding piece of our legislation because, in fact, the prevalence and severity of serious injuries to children is unknown in Manitoba. There is currently no centralized system that tracks and responds to serious injuries on a provincial level. And this was one of the key recommendations that was made in the Phoenix Sinclair inquiry, that the Manitoba Advocate for Children and Youth ought to be the office that is able to collect, track, investigate, and analyze how and when children are being injured in our province. And the hope, of course, is to be able to make recommendations that increase the safety of young people in our province and ultimately decrease the numbers of children who are being injured or who are dying. And so what's happening right now is that my team and I are working with the government table to bring this piece into force, and we continue to urge the government to complete this final piece of our existing legislation. But we do also continue to wait for the government to set a date for the final piece of legislation to be enacted. So the Advocate for Children and Youth Act is the legislation that guides our work in Manitoba. As I mentioned, it came into effect in March 2018, expanding our mandate considerably from before when we were only able to formally advocate under the areas of child welfare and adoptions. But under the ACYA, there is an independent advocate appointed by the Manitoba Legislative Assembly, and that's the role that I'm currently in. Our legislation now allows our office to take a lead role in advocating for children's rights in 8 designated service areas. And those are up on your screen right now. And they include child welfare, youth justice, mental health, addictions, education, adoption, disabilities, and victim supports. Our mandate allows us to call on public systems to address inefficiencies and gaps in services so that all young people have the opportunities they need to grow up healthy and protected and so that they can fulfill their amazing potential. We have the capacity through the ACYA to make recommendations directly to the government and to other public organizations, and also to track and report publicly on progress and compliance with our recommendations by governments and others. We all know that government systems and public services can be really complex and difficult to navigate sometimes. So our office exists to help young people and their families know where to go for help. We support young people so that their voices and their opinions are heard and considered when decisions are being made that affect their lives. And because this widened mandate just came into effect in March 2018, many folks still associate our office primarily with child welfare advocacy. Even though our work scope has broadened considerably, and we're now getting more public recognition and requests for help in other service areas every day. And importantly, any young person involved in any of the services listed on your screen and who are under the age of 21 are eligible for advocacy supports from our office. Ultimately, protecting children and youth and their legal rights to be supported in special ways as they grow is the responsibility of all Manitobans. Our office exists to help young people and their families when services are not meeting the needs of young people or when systems are not operating effectively or efficiently. So before we talk a little bit more about advocacy services, I want to underscore that MACY is an independent office of the Manitoba Legislative Assembly. This means that we sit outside of and apart from the government. And this is really important when advocating on behalf of children and youth to hold public systems accountable, and it's vital when we're conducting investigations and research. As I mentioned, other independent offices of the Legislative Assembly are offices such as the Ombudsman, the Auditor General, Elections Manitoba, and the Office of the Ethics Commissioner. Most of the designated service areas under our legislation fall under 5 key government departments, and they're listed up here on your screen right now. And we can provide official advice to any of those ministers, the ministers of families, justice, health, mental health, and education. We can also advocate for youth at any level, with service providers and agencies directly, with the departments, with ministers in some cases. And our office does both individual as well as systemic advocacy work. Our special reports, like our research reports, which I'll talk to you about in a few minutes, emerge from trends that we see in our work with children and youth. Findings and recommendations in those special reports emerge from the data we collect, which is free from government influence. And as the advocate, I'm also empowered to report publicly on implementation of government compliance with my recommendations that I issue through investigations and special reports. Each year, we publish an annual compliance report, which is a report card on the government of sorts, on how each government department is implementing the evidence-based recommendations that we issue in our reports. This information is available also at any time on our website. And I think that Jessica's probably going to put that link in the chat window right now, where you can find our most recent compliance report that we just released in December of 2021. And so at this point, I'm going to turn things over to Michelle for a few minutes to talk to you a little bit more about our advocacy services. Michelle?
Hi, everyone. There I am. So I'll talk a little bit about our advocacy services. And actually what you're seeing in front of you right now is a photo of our office on Portage Avenue. We have a storefront type building. And the reason why that's really important is that lots of young people actually do drop in, and they can see us quite readily because we're kind of smack dab there on Portage Avenue, right beside the former MTS Center, which has a new name now. But anyway, so that's kind of a big, that's an important thing for us to be really visible so that young people can find us. So the advocacy services program is kind of the direct service part of the program. We work individually with young people that come to our attention. And sometimes we do that on individual case matters. Sometimes it might be on behalf of a group of young people, but essentially amongst our advocacy staff, we have about 12 staff in advocacy. They work directly with those matters that come to our attention. And we do receive quite a few calls throughout the year. Last year, for example, we received 2,423 requests for service. Not all of those end up being kind of full-fledged ongoing advocacy matters, but those are calls that come into our office. What we found out during COVID was we actually received fewer calls overall, but more of those calls actually ended up being cases that we took forward into ongoing advocacy matters. So what we were finding is we were kind of getting fewer calls that were kind of not within our mandate, but we were getting more calls that we actually needed to kind of be involved in. The other thing I just wanted to mention was that in terms of who calls our office, we do get calls directly from kids themselves. We also get calls from lots of other service providers, families, other interested parties. And the one thing that we want folks to understand is that anybody that calls our office, we call those sources of referral, like they do in some other kinds of settings. All of our sources of referral will remain confidential. So whether that's the child that calls on their own behalf or whether it's a service provider that calls, we always keep that information confidential, unless, of course, that person wants to, sort of be wants the service provider, the other service provider, to understand that they made the call, and sometimes that happens too. The other thing I wanted to mention is that most of our calls do come over the phone. But as I mentioned, some folks come directly to the door, and at the end of the PowerPoint, you will see the phone numbers for the office. And I also had conversations with Fiona before this presentation, and Winnipeg School Division requested that we send posters out. So we have posters that have been sent to the office, inclusion support office, and they'll be kind of funneled out to all the schools. So anybody who's in a Winnipeg School Division school, you'll be getting a couple of posters to put wherever you'd like to put them in your buildings. And if there's folks on the line who are not with Winnipeg School Division but would like posters, then you can just call our office and we can happily send those out to you. So as advocates, or actually our staff are called advocacy officers, but most of the youth that work with us see us as sort of advocates. What we're mainly doing is listening to where kids are coming from and trying to advocate for what will be in their, amplifying their voice, as well as sort of what's in their best interests. And we'll talk a little bit more about that in a couple of minutes. So Jessica, if you can advance the slide, please. So what are we talking about when we're talking about best interests? Probably most of the folks that are watching have their own perspective of what best interests are. From our point of view, because we are sort of a rights-based organization, we are holding sort of in our mind's eye the Article 3 of the UNCRC, which says that in all actions concerning children, whether undertaken by public or private social welfare institution, courts of law, administrative authorities, or legislative bodies, the best interests of the child shall be a primary consideration. So assessing the best interests of a child means to evaluate and balance all the elements necessary to make a decision in a specific situation for a specific individual child or group of children. So in our work, we're taking into account both the child's rights, the right to have their best interests upheld, but also their own views. And we're assessing the ability for them to have a say in their own views. So for example, a very young child may not have the same ability to have decision-making kind of authority over their future as a 16-year-old or a 17-year-old. We're also taking into account the interests of the family, because we understand that children don't exist in a vacuum. They exist in family, they exist in community, they exist as part of a school system. So we're taking all those things into account when we're doing our work with kids and families. We're also taking into account things like culture and attachment and sort of the history for that child, where they've been and what, who's been important to them. So all those things kind of factor into the best interests. And sometimes when we're involved, we hear from service providers that they're a little anxious or nervous about us having a role, but really we're there to work in a collaborative way. Like, we're always wanting to kind of make sure that all the service providers that are involved, and there may be many of them, because sometimes it may be the school, it might be the agency, there may be justice involvement, there may be a number of different folks involved, but we all want to be working towards the same goal, which is to make sure that that child's best interests are being met, that their voice is being heard, and that they're on a better trajectory, they're on a good pathway. go ahead. Okay, so what happens when you call our office? So, because many people will first encounter us by calling, sometimes they walk in, as I said earlier, but in any event, whether you call or come in person, you will speak to somebody in reception. We do have 2 offices, one in Winnipeg, that's our main office. And then we also have an office in Thompson in the City Centre Mall, if folks have ever been to Thompson. That office is actually shared with the Ombudsman. We have one staff person who sort of does intake for the Advocate's office as well as for the Ombudsman. And that office has been around for about 3.5 years or that thereabouts. So requests can come through our reception. They are directed to either office, whichever is applicable. And for the most part, when you call, you'll speak to somebody fairly quickly. When a young person calls, we have a policy that will provide an immediate response. We do not want youth callers to go to voicemail. Lots of young people don't have reliable phones. Sometimes they have texting apps. Sometimes they don't have numbers where they can be called back and so on. So we really want to make sure that we're responding to youth callers immediately. For adult callers, we will try to respond immediately. So when you call, you'll likely be put through to an advocacy officer. Our advocacy officers do intake as well as ongoing advocacy work. So if you speak to somebody, that's the same person that you would speak to all the way through in most cases. And then we'll kind of have a conversation about what the issues are that you're calling about. So those, when we do get callers, sometimes people might be just calling to say, I have some questions. There's this situation going on, and I'm wondering if you can help. So we always want to be as helpful as we can be. But sometimes we'll say to whether it's an adult caller or youth, tell me what you've tried already. And so that person may have said, well, I haven't really tried anything yet. And so we might say, well, there's a few options that you might want to think about. Maybe you can try this, maybe you can try this other thing. And sometimes our callers might say, yeah, I'm going to try that. And if I don't get anywhere, I'll call you back. So we would call that self-advocacy. So where we're kind of offering some suggestions, and we might even do that with a young person, where the young person says, well, I'm trying to get a hold of my worker. I haven't been able to get a hold of my worker. I'm really frustrated. And we'll say, well, have you tried reaching the supervisor? Because, when you're not getting a call back from your social worker, you can try calling the supervisor. And the young person might say, no, I haven't tried that yet, but who should I call? We can actually usually find out who the supervisors are, give them the phone number, and then that person might say, well, I'll try that and I'll call you back. And we can say, sure, great, why don't you try that and call us back if it doesn't work out. That's self-advocacy support. Or we might say to that young person, do you want our help with that? So that young person might say, sure, yeah, I would like your help with that. And then in those kinds of situations, we would open up a file for ongoing advocacy. And then we would reach out to the agency and see if we can figure out a way to support that young person to have a conversation. So we always want to be as helpful as we can be. As Ainsley mentioned, we do have a mandate under those particular designated service areas. But even where we don't have a specific mandate, sometimes people will call us and we can certainly provide some referrals, some advice, some suggestions. Sometimes we can even informally advocate, where we don't actually have sort of a legal mandate to be involved. People might say, for example, recently we had a young person call about their sister, who is a person who lives with a disability, who's over the age of 21. So that young person is sort of outside of our mandate, but we did say, why don't we help by seeing what we can call, finding out some stuff, and we'll get back to you. So in that kind of scenario, we're providing informal advocacy, provided that the service providers are willing to talk to us. They don't necessarily have to, but we do try to be as helpful as we can be. You can go ahead, Jessica, and advance to the next slide. So one of the things Fiona had asked about was whether we could provide some case examples of the kinds of situations we deal with. And these were the ones that we talked about in a meeting prior to this presentation. So I thought I would go through some kinds of scenarios that we've seen, or maybe what we're doing about some of these issues that you see in front of you today. And so these are some examples essentially of the way we can be helpful or be involved. So for example, school attendance, and we know that this is a really big issue for many folks in schools these days. It was even prior to COVID, to be totally honest with you. We were getting quite a few calls about school attendance, and the frustration or the challenge is that the issue of school attendance, even when it's very chronic and problematic, isn't necessarily considered a child welfare matter. It's not considered a matter where a child is in need of protection. So we try to argue sometimes with agencies that, like, when a child's not attending school, we know that their trajectory will be very poor, and when they're not attending school, usually there's a reason why. And so what is that reason? Is it that the family's not able to get them there? Is it that the child doesn't want to attend? Sort of what's going on? So and the school, like most of you will know, kind of is, their hands are tied a little bit in terms of being able to address those issues. How does the school get that child in the door where the family is struggling to get them there? So we will get, I could give you like many examples of the kinds of things we see, and I'm sure none of those will be a surprise to anybody because you've probably seen them all as well. But sometimes it may be that the family is struggling with just the logistics of getting kids up in the morning and getting them to school because they're not functioning with that well themselves. So in those situations, we do have the ability to check whether a family is already connected to a Child and Family Services agency. So we have access to the database there. And where there is an agency that might have an open file, but maybe they're not really very active with the family, then we would contact CFS and say, this concern has come to our attention. What have you folks been doing to try to get these kids out the door to school? What supports are you providing to the family? Is there more that we can be doing? So that's a very common scenario where there isn't a Child and Family Services file open. Sometimes we can see that there's been a history of previous involvement. So we might still get in touch with that agency and say, hey, we see that you have a closed file, but we've had this concern come to our attention and we're wondering whether there's an opportunity to provide some supports. So that can be one way that we handle it as well. The bottom line is that it's, where this is kind of the only issue and the agency is saying there are no other protection concerns, the only problem is school attendance. Sometimes the agencies do not want to get involved, but we will try to kind of reframe that as like this. This is obviously a situation where the family needs some support, whether they need the support of a natural support worker, whether they need the support of having somebody help them bridge the gap between feeling comfortable in that school setting. So anyway, we'll try to do what we can to bring in as many folks as we need to try to help that kid get to school. So in the example of mental health and substance use supports, sorry, I'm getting a message that my internet connection is unstable. So you can let me know if anything cuts out. And this is, again, an area where we see lots and lots of referrals where folks are having trouble accessing mental health services or substance abuse services. And it's, in some cases, it's maybe not going through the right pathway, but in many cases, we just really don't have enough services. So that's sort of a reality that we're all dealing with. But some of the kinds of scenarios that we have been able to advocate in are where kids are facing long wait lists or maybe have been turned away for services. And we can, sort of basically try to use our influence to advocate to get that child into a service, or at least have somebody take a look at the situation a little closer to see if the referral fits the criteria for the program. So we can try to leverage our influence. Sometimes we find kids end up in sort of an acute care setting, like a PY1 kind of situation. and they're immediately discharged. So folks, again, that I'm sure nobody's surprised by that. We've seen that many, many times. And sometimes what we can do is if we're able to get in there quickly enough, advocate for the child to stay there a little longer to make sure that there's a better and robust sort of discharge plan, so that that kid isn't just being discharged to nothing, and that there's, you know, some follow-up that somebody has thought about to help this kid beyond when they're discharged from that kind of a setting. We have advocated in situations where kids need to get into the YASU program. We have advocated for kids to get into other substance abuse programs like Compass. So there's all kinds of different scenarios and ways that we can try to be helpful in that situation. And Ainsley will talk more about recommendations later, but we've made numerous recommendations about mental health and substance abuse supports in this province. And so that's definitely something that's on our radar. When it comes to transportation issues, this is an issue actually that recently came to our attention from Winnipeg School Division. The fact that, and I don't think it affects just Winnipeg, but certainly any in the city where kids living in families where they have very limited means, having trouble accessing funds to get on a transit bus to get to school. And sometimes kids are saying, you know, there is no money for bus fare and it's too cold to walk, so I'm just not getting to school. So we have, in this particular example, we have talked to the department. The issue is on their radar. So we're trying to explore, this would be an example more of a systemic issue that we're working on to try to explore what solutions there may be to address that. So we've also dealt with individual transportation situations where, you know, a kid in a rural area maybe isn't getting transported to school where they actually are entitled to be receiving that kind of a service. So there's a few different kinds of scenarios there. Remote learning, again, we've seen all sides of that one. We've seen situations where kids aren't feeling like this was earlier on in the pandemic, where they were wanting to be remote learning and actually didn't have the equipment. And this sometimes happens more so for kids who are in care, where, you know, they had to be remote learning, but yet the agency wasn't providing a laptop or anything to that extent. So we were able to advocate for those kinds of equipment pieces to make sure that the kid could be learning remotely. We've had calls in the kind of the opposite scenario where families are saying, my kid doesn't do well with remote learning, they need to be in a classroom. So we've kind of seen all of that during COVID. And of course, we're always conscious of wanting to be supportive of the school and the school policies and sort of what makes sense and what our public health officials are telling us and so on. But we're also looking at the individual scenario and what, you know, a way of solving the problem so that everybody feels like, you know, they can move forward. When it comes to equity issues, there's lots of different kinds of examples of this, but the sort of category of stuff that we see most often, I guess, is where there isn't really good case coordination. And that might be that, you know, maybe that a child needs more than the school has been providing. Because they are a kid who's experienced a lot of school disruption because they've been a child in care, for example. So there, you know, those kinds of situations come up for us quite a bit. We kind of lump them under this category of case coordination, but there's numerous examples of where the school might be really frustrated because they're not getting what they need from another service provider to help support that child in school. Sometimes it's the opposite, where you know, somebody else is very frustrated with the school. So our role often is to kind of bring everybody together, see if we can help brainstorm solutions. If there are solutions that people want to explore that they maybe don't have information about, maybe we can help by providing some of that information. So whenever those kinds of scenarios come up, we're happy to be involved and see what we can do to assist. The other biggie that comes up for us is school enrollment. So this happens typically around the time, like beginning of the year, sometimes around this time of year, where kids are having trouble getting enrolled. And often these are scenarios where a child is living with a family member that does not have legal guardianship of them. Sometimes they're not living with a family member. Sometimes they might be with somebody else. But essentially, the barrier is often that there's a private arrangement that's been organized, usually with consent of the actual guardian. So child is living with grandma and mom has consented to that, but there isn't a legal guardianship order. And so we're seeing less of this now that people are getting more comfortable with the idea of accepting informal guardianship arrangements. But we still run into this quite a bit, actually, where we need to get involved to advocate for a child to get enrolled into school. And we have talked with a few others about this, including legal aid. They've provided us with kind of a template of statutory declaration template that families can use and would be signed by the parent that basically says, I authorize grandma, auntie, uncle, whoever to act as a temporary guardian for my child, and they have the right to register them. They have the ability to kind of look after all the important decisions, et cetera, until we both agree that that's not going to happen anymore. I do see there's a couple of hands raised. Do we want to respond to questions? I can't actually see. I can only see that you do have a hand raised. I can't see what your question is, but somebody can tell me if we want to address those now. So in any event, just to finish my thought on the whole enrollment piece, we have had some conversations with First Nations Family Advocate, and they have a couple of lawyers on staff, and they can actually, for Indigenous families, help them with that statutory declaration document, help to draft it, and so on, where people are struggling with that piece. We're also hearing from the Department of Education that they are also concerned about this issue because it's been brought to their attention by us and probably by others too. And so they're looking at this issue because, as everyone knows, the Public Schools Act is quite outdated. It doesn't actually reflect, kind of what we understand now about the importance of recognizing kinship and private arrangements that families make in the best interests of their kids. Sorry, my cat's trying to get into the room. Yeah, so those are the case examples. And I think if others have any specific questions about these kinds of things, we can try to answer those later. Okay, so Jessica, do you want to advance to the next slide? All right, so I will just review briefly the other programs, and Ainsley will talk a little bit more about some of our research reports and investigations of note. I've already described the advocacy services program. We also have a research hub. The research team studies and analyzes systemic trends that we see for children and youth in the province, and they conduct child-centered research, which helps inform special reports that are released to the public by the Advocate. And these help educate the public about the experiences of Manitoba's children and youth and in special reports. Ainsley can make recommendations to government or to public service organizations for legislative or policy change or other service improvements. One large-scale piece of research that we are currently conducting involves the experiences of children and youth who are witness to intimate personal violence in their homes. The quality assurance staff, that's another team. So I think in the research hub, we have, I think we have 3 researchers, and that team also includes a systemic advocacy position, which is actually fairly new to our office. The systemic advocacy person was hired, I believe, just maybe prior to summer. And that's actually it's not just a new position in our office, but they're within the other offices like ours across the province, or across the country rather, there really aren't any other programs like it. So it's been a bit of a journey for us to determine like how best to do this systemic advocacy piece with a particular person assigned to that. But it's what's really great about it is that any of those kinds of systemic issues that previously we may have been sort of a little stuck on how to handle them, now we have sort of a better system for vetting those and figure out what goes to a larger report, or are there other ways of handling some of those systemic issues that don't require a big, gigantic report. So moving on to quality assurance, we have a quality assurance team who analyze data and other information to help our office understand internally and externally where additional opportunities to improve efficiency and effectiveness might lie. They are also responsible for monitoring, tracking recommendations made in the advocates report. Some of our team members are investigators who advocate for children and youth as we review and investigate the services that were delivered to a young person in the event of their death. Those staff are part of the investigations and child death review team, and the advocate sometimes releases summaries of those investigations as public special reports. And some of you will be familiar with some of those reports. Ainsley, I think we'll talk about one or two of them in a bit. You might recall the report we did on Tina Fontaine's life back in 2019, or the report on the slow disappearance of Matthew from 2020. Along with our youth suicide research, these are all reports that have been prepared by investigations team alongside their daily work of reviewing child and youth deaths in our province. We also have a youth engagement program, and that's a program that I supervise as well. And that program works directly with youth, including our Youth Ambassador Advisory Squad, and I'll say a little bit more about that in a minute or two. And the other part of that youth engagement work is working more generally across the province to engage young people in what our office does and in rights promotion work. So a couple of years ago, we did a listening tour, and the purpose of that listening tour was to really reach out to young people across the province directly and ideally in person to find out what issues that were important to them in their communities. And as a result of that, we actually released a report called The Right to Be Heard, and folks can see that on our website. So that team is also fairly new to our office, just started in 2018. So it's been a bit of a development, but there's been some pretty important things that have come out of that group so far. And we also have a public education program. Jessica, who is manning the chat and the slides, is the manager of that program. And the public education program helps support all of the other departments and make sure their work makes it to the public's eye and ears in creative and strategic ways. This involves design, social media presentations, media releases, and much more. And believe me, there is quite a bit. So this is a slide that gives you two lovely photos of our YAS team and a big piece of work that was completed this past summer. Our YAS team is made up of young people, typically with lived experience in one or more of the domain areas that our office has a mandate in. They are between the ages of well, right now, they're between the ages of 17 and 23, but we can accept youth in YAS between the ages of 14 and 24, actually. And we're always open to new referrals, but it is important that the young people that come to YAS have an interest in speaking their mind, because we want to hear from them. It is important that they have some lived experience in one or more of the domain areas, because we really want to understand what kids are feeling and thinking and experiencing in those services that we're working in. So that right now we have about actually 10 sitting members, and we also have a group of youth kind of on a support list that sometimes might be called upon, or we might ask them to help out with volunteering or be involved in a larger project that we might be involved in. But over COVID, for the most part, we've been mainly focusing in on our YAS group, which is about 10 youth now. So the photo on the left hand side of the screen, is a mural that that our Yaz youth painted last summer as part of a project that they actually thought of. It was their idea. And two of our youth actually were leading this project, and came up with a name for it, and it's called the Rewrite Project. And essentially the goal of the project is to paint murals across Manitoba depicting all 42 articles of the UNCRC. So they went through a bit of a training to learn how to organize a project. And Jessica has put in the chat a little bit more on that Rewrite Project. And there's actually a video that was done, which was a very nice kind of explanation of the project, so folks can find out a little bit more about it there. But we're currently, the next iteration of that project is to work with other youth serving organizations and partners across the province. So currently we are working with the CMHA, and they are going to be painting one of these murals in their youth hub, their new youth hub on Broadway. We're also working with the Bear Clan. One of our mural leads works at the Bear Clan, so she's kind of the main liaison there between us, our Yaz group, and the Bear Clan. And the third group we're working with right now is Marymount, and they're going to be painting a mural on their school actually in the summertime. So we have 3 projects underway, so that's pretty busy. And we're also in discussions with a partner in Thompson to do a mural up there somewhere. And that hasn't been, the details have not been sorted out, but it's a pretty exciting project for our young people. The other thing I'll just mention about our Yaz youth is this last fall, I guess, when a couple of our Yaz males, Trevor and Michael, they were very involved in a special report that came out from our office called Finding the Way Back. And they actually, as part of that, were engaged in a digital storytelling process. And as a result of that, they came up with a rap video, because they're both very talented rap artists. And that was depicting kind of their experience as young males in the system. So if folks are interested, they can take a look at that rap video. I think we can go on to the next one. Ainsley's up.
Okay, thanks very much, Michelle, for all that information. So I also want to tell you a little bit more about some of the folks who kind of wrap around our office and provide additional support and guidance to us. So we at our office also have a full-time knowledge keeper on staff whose name is Cheryl Alexander, and you can see her pictured here holding a bundle of medicine. And her role at the office is to ensure an Indigenous presence by sharing knowledge and wisdom and providing advice and guidance to our many different program areas that Michelle reviewed for you. Cheryl also supports youth and families in our advocacy, investigations, and research programs when additional cultural supports would be beneficial. Cheryl provides cultural teachings to our staff, as well as opening and closing meetings with prayers. She's present at relevant community events on behalf of our office, and also often alongside other MACY staff who attend. Cheryl assists in the search and selection of youth ambassadors for our Youth Ambassador Advisory Squad. And she also helps us select elders for the Elders Council. And finally, she leads our staff as well as Yaz members in medicine picking, sweat lodges, beading, and sewing, and many other activities around the office. So we also have up on your screen right now a picture of some of the elders on our council. Our full council is actually made up of 7 elders, and 4 of them are pictured right now alongside myself and Cheryl. We at the Advocates Office are committed to creating meaningful dialogue with First Nations, Métis, and Inuit people in Manitoba. Collaborations with elders and knowledge keepers help guide our office's work for Indigenous children and youth. The Elders Council provides spiritual and cultural guidance related to the ongoing work at our office, and specifically supports myself and the 2 deputy Manitoba advocates in developing relationships with First Nations and MACY government structures, their leaders, and their communities. The Elders Council also consults on reports that are underway at our office. Sometimes recently in a report that I'm going to be telling you about in a few minutes, they join me for some of those public releases to offer some wisdom and guidance as part of the public release process. And they also provide guidance and wisdom to our leadership team to ensure that all of our services are provided in a respectful and culturally inclusive manner. The Elders Council and the Knowledge Keeper, Cheryl, consist of members from Indigenous communities that are representative of the children that we serve. So I want to tell you a little bit about some of our special reports, which I mentioned before. These typically, as I said, emerge from the stories and the trends that we see from our investigations or our research teams. Often they include formal recommendations from the Manitoba Advocate to address service barriers and gaps. So I'm going to focus today on some of the education-related recommendations, which may, of course, be of most interest to this particular group today. So as part of our investigations, we review the public services involved with the child or their families, such as mental health, addictions, education, justice, and the other areas that we mentioned. We might request documentation or other evidence from service providers, and we, through our legislation, are empowered to interview service providers and other people that are close to the child or family to increase our understanding of the story of the child, of their needs, or the needs of their family. Of course, COVID permitting, we might also visit a child's community to gain understanding of the resources that are available or were available, and so that we can better understand the context in which services are being delivered. In our child death investigations, we'll typically invite the family to meet with us so that we can understand their perspectives on the services that they received. And as I mentioned, recommendations may be issued by the Manitoba Advocate to the government or to really any other service providers for improvements. Under the ACYA, I also have the ability to release public reports regarding the services that we review or investigate. Being open and transparent with Manitobans about what we're seeing is important to help create systemic change for children. The office has certain goals when releasing a public special report. First, we want to tell the story of the child or their family in a way that's accurate and based on evidence. We always work to tell the story through the eyes of the child. Our second goal in releasing a report is to increase public awareness of services, as well as gaps in some of those services. We know that communities are safer and more inclusive for young people when we all understand their unique experiences. And third, our goal is to promote transparency and accountability for ourselves as a review and accountability body, as well as to increase accountability of public systems. The Advocate's recommendations are always based on evidence and designed to increase the effectiveness and responsiveness of public services. Since 2018, when the expanded mandate of our office came into effect under the ACYA, we've released 14 special reports. You can find all of our reports to read on our website, manitobaadvocate.ca, and I think Jessica's put that link in the chat. And then we can also offer presentations on individual special reports if you have an interest in a particular report to groups who are interested, as well as on certain issues. So for example, we sometimes do presentations on issues like suicide and some of the suicide research that we've been conducting for many years. So a few years ago, the Kindergarten to Grade 12 Review Commission that operated in Manitoba asked us to make a formal submission to their process. We sent them a summary of our education-related concerns, and then we also made that submission publicly available through our website to all Manitobans. The 5 key themes that we outlined in that submission are ones that we continue to see prevalent in our work, and Michelle spoke to some of those a few minutes ago. Those issues include chronic and severe absenteeism, suspensions and school dropout rates, education access issues for children with disabilities and children with behavioral concerns, barriers to school enrollment, a lack of youth consultation when it comes to education policies. And again, Jessica's putting the link for our K-12 Education Commission submission in the chat function there. So some of the recommendations that we've made to Manitoba Education formally pursuant to those themes include we recommended that they conduct a review and develop a province-wide strategy to limit exclusionary practices such as suspensions. And those recommendations came out in two of our reports. One of them in 2018 was a report about a boy named Circling Star, and in 2020 was our report about the slow disappearance of Matthew. And that recommendation also appeared in that report. We also recommended that the Department of Education review its measurement of absenteeism, suspensions, and expulsions, and that it create a province-wide strategy to address those issues. And that particular report was in our Tina Fontaine report in 2019. Manitoba Education has reported significant work underway on some of the issues that we have raised formally with them through recommendations. And in fact, in 2021, just about a month and a half ago, we were able to officially close two open recommendations that we previously made to Manitoba Education, because we were able to assess that the department was fully compliant in these two specific areas. And so those included that we recommended that the department highlight and promote provincial learning objectives focused on mental health literacy and well-being coping skills. And that again was in our 2020 report detailing the life of a boy named Matthew. And the second recommendation area that we were able to close as fully compliant with respect to the Department of Education was when we recommended that the department continue promoting the safe and caring schools policy in school divisions so that all schools in Manitoba can learn about those optional tools. And that recommendation was also, you can also find that one in the MACY report from 2020. So Manitoba Education, for your information, is currently the department with the highest compliance levels when it comes to recommendations emerging from our office. As of December 2021, we did assess them as the department with the highest compliance levels across multiple departments. This last year, in the report that came out in December 2021, they ranked an overall compliance rate of 75%, which was significantly up from 2020 when they were only at a 42% compliance rate. Since 2020, the department has made significant progress in its implementation of recommendations from the Manitoba Advocate. In the fall of 2021, we added additional recommendations for Manitoba Education aimed at further developing its Indigenous inclusion strategy and developing sustainable initiatives in anti-racist education. Those recommendations can help close the achievement gaps between Indigenous and non-Indigenous students and make schools safer environments for racialized and BIPOC students and more cohesive and effective spaces for all students and staff. Those new recommendations were included in the report that I released in November that we referenced before, and it's called Finding the Way Back, an aggregate investigation of 45 boys who died by suicide or homicide in Manitoba. And so that link is going up in the chat right now. And what you're seeing on your screen right now is a summary of the 5 recommendations that emerged from that report, 2 of which were aimed at the Department of Education. Of course, there are lots of issues in schools and in the education sector that are not yet covered by formal recommendations from our office, and some which are issues that we work on through other avenues, such as our advocacy services program. Michelle was able to provide you with some information about some of those, such as the ongoing barriers to school enrollment that some students face. And I know that there was a question posed in the chat about that. And so I just wanted to follow up by just verbalizing that if there are students that you're aware of that are experiencing barriers to enrollment, probably the best thing to do is to give our office a call or to encourage the family to call us if they're able to. You can certainly call on their behalf. We get teacher calls all the time. And we'll connect you with our advocacy services department, and we can walk you through what that looks like to help get kids enrolled for school. And of course, if there are other issues that you're seeing in your work, in education, we're always open to hearing what those might be and how we might be able to assist and help. So with that said, we're going to get into questions and comments right away. In the meantime, our contact information and the different ways to get in touch with us is up on the screen. If you ever have more questions about our office, or if you need help accessing services for children and youth, and I know that it's primarily an education focused group today, but certainly, if you are aware of young people who need help in any of those domain areas, so sometimes you have a child that you're connected with through your work in education that you're aware has some additional barriers or challenges that they need assistance in from other service areas, we would just really invite you to get in touch with us and see if there are ways that we can assist and help the young people that you know of. So as Michelle mentioned before, we have offices here in Winnipeg at 346 Portage Avenue, which is really close to Portage Place Mall downtown, and in Thompson at the City Center Mall if you want to visit us in person. We are, during COVID, because we're an essential service, we are still welcoming people into the office. We just do a little bit of a screening questionnaire before you come on in. And but most folks are contacting us through other means, primarily through phones these days. And so our phone numbers are up on the screen right now. You can, of course, find us on social media. We'd encourage you to follow us as well. We put out a lot of information, a lot of links to relevant information about what's happening in the lives of the young people in Manitoba. You can find us on Facebook, Twitter, Instagram, YouTube. I hear there's a TikTok channel coming at some point. And you can search for us through just looking for Manitoba Advocate. And so with that, that sort of wraps up what we wanted to offer you today, but certainly we are open now for any questions. If you have any questions about our services, you can certainly feel free to raise your hands or unmute your microphones, jump in. I'm not sure, maybe Fiona, I'm not sure if you want to facilitate some of that. I know Jessica had mentioned before because she's doing her screen share, she might not be able to see all the questions. So maybe I'll turn it over to you to do ask some of the questions that might be coming in.
Absolutely. All right. One of the ones I see here is from Amy. It says, what recommendations and follow through have occurred for children with exceptional needs? I feel several divisions fail at this. I just found out my children's school has yet to have any staff take any inclusion classroom courses, as there's no, perhaps not enough interest, or I'm not entirely sure why. So maybe Amy could elaborate on that. So how can we encourage our schools to make this mandatory? So that was Michelle? One of the questions, and maybe Amy, if you need to fill some of that in, I'm not sure if I did your question justice.
You want me to answer that? I can take a stab at it. Well, I think folks probably know that there are, from the department, there are expectations that that schools use an inclusive approach to providing education. So when that's not happening, what I would say is you could probably contact our office, and we could sort of do some not investigation formally, but we can kind of explore with the school, why that's not happening. And of course, when somebody calls our office to say, I have this concern, the source of referral always remains confidential, as I mentioned before. So it's, sometimes we do get these kinds of calls that we would say it's not necessarily about an individual, but it is a situation where we could definitely explore what the school is doing, why they haven't done it, and how can we assist them in getting to the place where they need to be. So that's probably, I don't know if Ainsley, if you have anything to add, but I would say, like, if you feel like the school's not doing what they need to do in that regard, then give us a call and we can definitely explore it.
Yeah, that's often the best way, especially if you're sort of thinking about a particular scenario. Usually the best way is just to give us a shout on our phone lines. I'm also putting in the chat, we did release a report last year. We did a review of the disability system and how it coordinates with other systems in the province as well. And so that one might also have some, I don't know the exact scenario that you're thinking of, but that might have some relevant information for you as well. And that was also a report where we issued some specific recommendations to the government to improve services for children with disabilities.
All right.
Go ahead.
Does that answer your question, Amy? It sounds like that was a really good answer. I've got another couple questions here. Can student-led advocacy groups have a meeting with MACY for support in the group's actions? I think that's a
Yes,
great question.
absolutely.
Absolutely. We would love to come to your school.
Yes, for
We
sure.
would love that. Yes.
That would be awesome.
And
I
one
was
of
just
the
going to say
other
that
things
we,
that I would okay, go ahead, Michelle, and then I'll add something.
well, what I was going to say is we've actually thought about trying to expand that youth engagement to working with individual schools. And we made a few attempts with a couple of schools and it kind of didn't go anywhere. But because, you know, sometimes people aren't ready or for whatever, you know, whatever may be happening at that particular moment. But we absolutely encourage, if you think you have a group that would be interested in doing that piece, or if you already have a group that is established and you'd like to do more in terms of rights work, UNCRC based or otherwise, then for sure we would love to explore what that could look like with you. And we can for sure come and do a presentation or whatever. We can do more than that too if there's an interest. So I would encourage you to reach out and you'll probably talk to me about it.
The thing that I would add to that is that we also have, we've designed some curriculum material for specifically focused on children's rights that we've put out as part of a 2 years in a row now, an initiative around Child Rights Day on November 30th of every year. Oh no, November 20th of every year is National Day of the Child. And so we've the last couple of years put out this initiative called Got Rights, and they're little boxes of material and some information about the United Nations Convention on the Rights of the Child. They include a lesson plan. They include a bunch of information about children's rights. And those could maybe also be used as a foundation for getting young people together to start, you know, a rights group or something in the school. We would be thrilled to support schools in doing that. So just please get in touch with our office if that's something that you'd like to do. We would 100% support that and come out and help you in whatever way we could.
Yeah, and I think your follow-up was, can you just use the info email? And yeah, that's probably easiest. You can use the info email and the receptionist will direct it to me. Or you can call.
Great. That is a really, really awesome activity. I find so many children and youth are so excited to learn that they have rights and to get engaged in that. And there's so many ties we can make, you know, even the right to mental health and how, you know, active we can get, you know, folks involved with their own rights, which is very empowering. All right, we have another question here by Penny. How can you help clients and their case plans in order to get their children back?
Okay, so we do get lots of requests like this for assistance, I would say. Often it's families that may be calling to say, you know, I feel like my worker's not working with me to plan for reunification. So, I mean, we can definitely have a role where obviously it depends on the individual situation in terms of, you know, whether everybody's ready for reunification, et cetera. But if families that you're working with are saying, I feel like I'm ready and I'm not getting help from my worker, or that's not part of the case plan, then they can definitely contact us. So you can contact us on their behalf and connect us, or they can contact us. And we do that kind of stuff quite a bit, actually, where we're working with the agency to say, you know, what is the case plan? Where are you at with that? What are the expectations? How, you know, where is the parent at in that? So sometimes I think that what we see now is we see agencies definitely more so wanting to work towards reunification, particularly with the new federal legislation, which people call Bill C-92, but it has kind of a longer name now. Anyway, so we see a lot more interest and willingness to be working with families to reunify, but sometimes there are things that kind of get stuck in the way. So if you see that problem, then definitely give us a call. Every individual, like every situation is different, so it's hard to, you know, there isn't necessarily a straight pathway there, but for sure, call us.
All right. All right. I just had a follow-up here. My question is, why can child caring agencies, foster care, and case managers apprehend children and then take them home for a long period of time? it is another form of what has happened regarding the residential school. So I'm not sure if I just asked it the way it was written, so I'm not sure if that person would like to expand on their question a little bit more, or if does that work?
Well, in terms of why can they do that? I mean, child welfare agencies have the mandate to intervene and apprehend and make case plans as they see fit. There are checks and balances within that system, but is it perfect? I would say, and probably most people would agree, no, it's not. So, again, if there are those kinds of scenarios that you're familiar with, that you're hearing about, or that you're involved when you're supporting the family or whatever, and you think that, the agency really isn't seem to be planning in this child's best interest, then for sure call our office and we'll take a look at what's going on. We'll call folks at the agency to kind of find out what the perspectives are there. We'll try to bring people together to strategize to make a plan that's in the best interest of kids.
Mm-hmm.
All right. Thank you, Michelle. We got another question here. With the bringing our children home bill, we are seeing lots of family reunifications, which is wonderful. However, reunifications without supports in place for it to be successful, and then files are being closed immediately. Would that be a situation where folks can call your office?
Yes, absolutely. That's a type of phone call that we get often. It certainly, I think, has increased over the last couple of years with the introduction of the federal legislation and more nations moving forward on reclaiming their inherent jurisdiction. One of the areas of concern, of course, as children's advocates, is that we want to make sure that children have what they need, regardless of who is their caretaker and who's their caregiver, whether they're temporarily in care or whether they're being transitioned back home, that families need robust supports to ensure that they are able to resume care for young people in a successful and supported way. So if you are aware of situations where kids are not being properly supported, where families are not being properly supported, and where agencies are not fulfilling their mandates in the way that they ought to, those absolutely, we would encourage you to give us a call and see if there's ways that we can help out in those specific situations. Michelle, did you have anything to add on that one?
No, that's, call our office. We see those things all the time.
Yeah.
All right. And then there was just a follow-up regarding the question around children being apprehended. And this person had just stated they had made a call to the office and hadn't gotten a response. So in a situation where folks have maybe called the office and haven't received a response, or maybe felt that they weren't heard, what would your recommendation be, Michelle or Ainsley?
So sometimes that can happen, or maybe we've tried calling back and we haven't been successful in reaching somebody. Or maybe something got missed. That's quite possible. So I would say, call us again. You can also send an email, and if we have we'll still want to talk to you, actually. Like, even if people send emails, we say, give us a call or give us a number where we can reach you. Definitely call us back. Again, depending on the situation, sometimes kids are being apprehended and there's an investigation underway. And where there's an investigation underway, that may have to run its course before we can sort of understand what the case plan is for the child and kind of have any meaningful involvement. Sometimes we, if the investigation is taking a really long time, we might sort of say to the agency, why is that happening? So every scenario is different, and it's difficult to kind of respond in a general way to, why does that happen? But if you haven't received a response, then definitely give us a call back. You can, if you feel like you haven't gotten a response that you thought was really answering your question, you can talk to a supervisor or manager. That would be me or my colleague. So we're definitely here to respond if you give us a call. Thanks.
So the other thing that I'm going to add to that is I'm just putting in the chat function. We also have a complaints policy. This just sort of reminds me to talk about that as well, because we're always striving to get better and do better, as a service organization. And so if there's ever a situation where, we didn't do what you thought we were going to do, or you are concerned about the service that you received from our office, I would genuinely invite you to please let us know about that, because as Michelle said, sometimes, you know, things just get missed, or it's a miscommunication, or we tried to call and nobody answered, or, you know, there's often been cases where we call the number that's been left and it's not in service, or it's been changed or something like that. And so but we certainly try wherever possible to get back to people in a really quick and timely way, because we understand that when people are calling our office, it's because there's an urgent situation. People don't typically call us when things are going well in their lives. And so we want to make sure that we are being responsive and effective as a service, support, and advocacy organization. And so give us another opportunity to try to make that right, and either contact us directly through our info at Manitoba Advocate or our main phone line, or if you have a specific concern or a complaint about something that happened, please use the complaints at manitobaadvocate.ca.
Right, thank you very much. Penny was looking for just a little bit of a follow-up on her question regarding helping clients maybe get their children back, and had stated that they have hired 6 support folks from the United Way, and then was just asking if you were familiar with the type of work these folks do.
I'm not clear exactly on what the question is.
All right, Penny, do you want to maybe just clarify that?
You can unmute yourself if you want, Penny. Maybe that's putting her on the spot a little bit too much.
Yeah.
I have not, I'm trying to think of what program that is, but it doesn't ring a bell for me. But sometimes, you know, programs have particular names, and I'm not sure where they're connected to. So, but we're also learning about new things all the time. You know, yeah, I think
They're
actually,
unable to mute.
yeah,
Thank
I think
you.
you have to be unmuted by the host or something like that. But yeah, so if you have information to share, Penny, about a service, then I think everybody's always happy to hear about a service that we don't know about. But we hear of new things quite frequently, I would say. So we try to keep our ears to the ground about what's out there. But there's always new stuff that's being developed. Oh, okay.
Hi there.
Hi.
Hi, thank you for having me. I'm so sorry.
Oh, that's okay.
Yeah, so I'm actually a social worker, but I'm also a counselor in the agency I work for. It's a non-for-profit in the West End, but we just hired a year ago, or not even a year, 8 months ago, a family support liaison. And I guess United Way hired 6 of them in different resource centers in the city of Winnipeg to do this kind of advocacy work. But in my primary role, it's been the case where I see a lot of the CFS clients fulfilling, whether that mandate be providing them counseling, short-term therapy, and I've been known as the expert. So part of my day is to help the new advocate, help get the kids back in the parents' care. But of course, as you know, case plans can be pretty ridiculous, and we still have tough cases where we're dealing with some clients with high mental health issues, high addictions, you name it. So I think we always come across that. So I just wondered if you guys had worked with them, or you guys are willing to work with us, because I still find like we always put you guys on. We do actually a 1-day workshop on working with CFS to try to point CFS as a positive light, even though it can be a difficult system to work with and difficult workers to work with, as you can. But we try to work with them. But of course, we have clients who just hate their workers, which I understand, because when you've had your kids taken away, and I can't imagine if somebody did that to me. So my heart goes out to people, but it's sometimes hard can work with the system, because you understand what the system is dealing with, their caseloads and what they have to do as an obligation. But then when they're struggling and they're doing everything they can to fulfill it. So I just wondered if you guys would be willing to work with us, or could I call you guys and consult? Because I think it could be some great work, because we always put you guys on our resource page. I always mentioned you guys. I just changed it from Children's Advocate to the Manitoba Advocate, because I tell people you guys are still there. So thank you.
Yes. No, absolutely. Thank you for that question and for the explainer on that one. We are absolutely always open to working with community-based organizations. one of the things that we're able to do because of our legal mandate is, we know that sometimes community organizations can have a tough time sometimes connecting with workers or getting workers to attend meetings and those sorts of things. And so that's one of the benefits of working with an office like ours, because we do have a legal mandate where the organizations and services that fall into our formal scope of review have a requirement to work and respond to us. And so sometimes we're able to leverage our legislation in a good way to get better outcomes for families, because those services are required to respond when we call them. And so certainly give us a call at any point, Penny, or send people to us if you want to collaborate with our office. We're always open to doing that. We are thrilled to work with anyone who wants to work for kids. That's basically
Awesome.
our bottom line. Yeah,
that's good to know, because I think a lot of our clients are struggling, and people always come to me, especially my coworker. Like yesterday, she came into a crisis morning and she doesn't have much experience, and she was asking me, and she wasn't getting through to the worker. And then when she gave me the worker's name, I was like, wait, that's a supervisor. I just talked to her 2 months ago. She's like, maybe she got promoted. I said, she's like, have you ever had any challenges with her? I'm like, not at all. But she kept having that challenge. And I said, okay, maybe if you can't get through to her again, let me know. But if not, maybe let's get the Manitoba Advocate involved. Let's get our liaison. And maybe the Manitoba Advocate doesn't even know we have these liaisons throughout the city, because I think United Way just saw such a need in resource centers, because we have so many kids apprehended. And I'm glad they created these positions. It's just now some of them aren't equipped, like myself, who just has dealt with the experience working in the field for so long that it always comes back to me, and I don't always have the answers either. So I'm just trying to find as much support I can from me, my coworkers, and the clients we serve. So
for sure. And one of the other options that we might be able to explore is maybe the 6 or 7 different resource workers or community-based advocates. Maybe we can get together on a table with some of Michelle and some of the folks in our advocacy program, and we can create some really easy pathways for you to reach out to our office so that you know exactly who you need to call when particular situations are coming up. We can certainly sit down and talk about
that would be great. Yeah, if I can't do it with the other resource centers, I know they're trying, but I know for our agency, for sure, with the therapy department and the frontline staff, maybe, as well as the resource workers we have, because I think we all have different experiences and areas, but everybody still comes to me, and I don't have all of that, and I could use as much support as I can. So
so what I'd suggest you maybe do then, Penny, is just reach out to Michelle directly after this, and then the two of you can maybe chat about what that could look like.
Okay, thank you. And I thought I'd just share that resource with you guys, if you guys had not known about it, or other people didn't know that now they're in different resources centers in Winnipeg, which is great to have. But
thank you.
Yes, thank you.
Thank you, Penny. That is great to know.
I'm going to put my email in the chat, and then if anybody wants to email me directly, they can.
I'm seeing some really good questions, folks. So here is a really good one. Is there a partnership between MACY and the First Nations Family Advocate Office?
Yeah, and so this is actually a really good segue into that question, because we have a great relationship with the First Nations Family Advocate Office that's developed over many years. And again, because their office doesn't have a legal mandate, we often and frequently work with them in a collaborative way to ensure that the families that are coming to their attention can also be supported through our advocacy services. And so we have a relationship through our advocacy department with the First Nations Family Advocate Office, but we also have other relationships. So for example, we are in the midst of conducting a bit of a research piece for them. They came to us with some specific questions around First Nations child mortality in Manitoba. And so over the last, I'd say like 8 months or so, we've been working closely with them to answer some of their data specific questions around where and when and the frequency of First Nations children dying, that are connected to child and family services. And so we're embarking on some of that work with them as well. So there's a lot of different, back and forth. There's a really good relationship between our two offices.
Great, thank you. I have another question here. Thanks, folks. You're giving lots of great questions here. How would a family access a statutory document for temporary guardianship, and is there a cost to them? I'm assuming there's probably quite a few questions around that document, how to get them, etc.
So we have the document that was provided to us was actually originally drafted by legal aid. There's no cost to it because it's just a template, and you essentially kind of fill in the blanks. And so we've sent that out to numerous people who have requested that, and we can definitely share it if folks, I can even share it with you, Fiona, and then
Sure.
then you can kind of share it with folks, because again, it's just like you fill in the blanks, and it's actually written as like kind of in a legal template, but it doesn't have to be signed by a judge or anything like that. They do, most divisions will request or prefer that it's signed by a commissioner of oaths. I'm not necessarily sure that that's always required, but anyway, it's there are we also have and you probably have access to this too, like a list of commissioner of oaths across Manitoba. So it's usually not that difficult to find something like that to witness it, but I can send it to you later, Fiona, and then you can share it with others.
Absolutely. Absolutely. Yeah. All right. Is there any other questions? Oh, I have another one here. It says, you are sounding very accommodating. In the past, I know if I'm calling about an agency issue like child welfare, I would normally start with the supervisor and then the authority before I would access your service. Is this still the expectation? So it sounds like when you're dealing with child welfare.
No, you can call us at any point in that. And sort of what Michelle was describing before, is sometimes people want to just have information and then, about who to call, and then they want to go and do it themselves. But there are lots of situations where people either feel uncomfortable making a call on themselves, or they just want us to get involved because there's a perception that, we can get faster responses or, move the issue along to a better resolution. And so just if you have a concern about a young person, I would just really invite you to call us and see what we can do to assist you.
All right. And thank you for the clarification there, because historically there was this very lengthy process that we were instructed to utilize before we contacted your office. So we do appreciate that clarification.
Yeah.
Fiona, I just want to respond. I see in the chat that there is a comment that unfortunately direction this year is that school division will not accept those templates. So not that I want to open up a can of worms, but we actually had a bit of a little problem with Winnipeg School Division on this particular issue. And I went to the director, and she assured me that those templates can be accepted. So I think that those things are being worked out. Oh, you're not Winnipeg. Okay. So if you are not Winnipeg School Division, you're Brandon.
Okay.
So in those cases where really we've had pretty good luck with almost any school division we've dealt with, once we've gotten involved to advocate for the use of those temporary guardianship templates, because there isn't any reason why families can't make good decisions for themselves. So, we don't want to encourage people to have to go to child welfare when there aren't protection concerns. And that's kind of been the other practice, right? So where kids are with a family and there isn't an order for guardianship, and they're told then go to CFS. No, we don't want people to go to CFS if they don't need to be going to CFS. So yeah, if you're saying your division won't accept those templates, then please get in touch with us and we can talk to your division and we can kind of let them know the experience we've had with others and why we want to sort of have a more inclusive approach to supporting private arrangements. So yeah, I always forget that this can include folks that aren't part of Winnipeg School Division. Definitely get in touch with us if you're having struggles in that regard, and we can advocate for a better, more inclusive way of handling that.
And so I just wanted to add, we're also advocating at the department systemic level on this issue, because it is a key issue that affects kids across the province. And it's, it's been explained to me, why they have these rules in place and everything. But honestly, it's the kids that really need to get enrolled in the situations that are coming to our attention. They get caught in this, this gap in the system. And so we're also advocating at the department level that they figure out how to nuance some of those pieces. So, wanting to make sure, what was explained to us was that the reason for the guardianship and how that has to be connected to enrollment is the example that was provided was around elite sports and not wanting to have kids move from one division to another just for the sake of playing sports. And so our comment back to the department, of course, as well, but it's also catching all of these other kids that just actually need to get enrolled in school.
Mhm.
So, you know, we're really urging the department to figure out how to figure out the details of that and really nuance those differences, because there's far too many kids that are getting caught in that gap. So absolutely, if your division is not accepting those declaration forms, as Michelle said, please get in touch with us and we'll advocate directly with your division.
All right. And of course, the questions keep coming in with respect to this, because I think that this is an area that many folks share.
Yeah.
And Michelle, thank you for clarifying that. The template is to be provided to help enroll the child to school. So that one was answered. And again, for the folks in Winnipeg School Division, I will do my very best to get the information out to you regarding these templates. And I think probably Jessica would have the email addresses of the folks that registered outside. So maybe that would be a great way to get that template out to everyone then.
Yeah, for sure.
That-
and if you
that might
don't
be a
end
good
up
way.
getting it, if we miss your email address, just send us an email and we'll send you one.
Sounds great. Okay, we have another really good question here, which I think is probably hot and forefront for everyone. How do you deal with situations where children need mental health services, but the wait lists are sometimes 2 years long? How do you help that youth? And I hear this one every day, so thank you for sharing that question.
Yeah, this is a huge issue because there are not enough services. So, you know, we can't sugarcoat it. It just is, there just isn't enough. And I mean, primarily, well, I mean, there wasn't enough even pre-COVID, but even now, you know, sort of, we're seeing, you know, kids really struggling these days, and I'm sure you folks are too. So, I mean, essentially, we have no magic wand, so we can't necessarily, you know, manufacture something on the spot. But what we can do is try to sort of understand what has already been tried. Where has the family gone? Where's the child gone? You know, and it might be that they're trying things that maybe aren't the right fit for them. And maybe there's something else that we can suggest. Maybe they've been turned away from a service that they actually should have access to, and we can try to advocate to that service. Yes, there are waiting lists. Sometimes if the child is, you know, if their need is quite high, maybe we can advocate for that child to be put up a little bit higher on that waiting list to kind of get services more immediately. Like there isn't a lot of good answers, honestly, because we struggle with this issue, and we have made recommendations. Some of those have been followed, but you know, I think our compliance rate on the mental health recommendations is actually kind of poor. So it's definitely a frustration, and we continue to work on encouraging the government to improve and increase mental health services where there are gaps.
So one of the other things that I'll say, in addition to the case specific advocacy, here's another area where we are advocating at a systemic level with the different government departments, certainly with the new mental health department, but also with health, because as many of you on the call will know, the expectation for many caregivers and service providers is that kids enter the mental health system through the emergency departments of hospitals. And so we have, mental health is the area that we have made the most recommendations in since 2018. And it's an area that we continue to talk with the government about and work with them specifically, not just through those recommendations, you know, once a recommendation comes out, but through our quality assurance department. We work around the year to track and monitor and encourage the government to continue to do more for kids with respect to mental health. That the big Virgo report that came out that looked at the mental health systems for both adults and children, that one came out in May 2018. And so what we continue to say to the government is that it is unacceptable that this many years later, they still don't have a strategy and a plan that they've published for all of us to understand what their investment plan and what their service plan is going to be with respect to children and youth. They have certainly made some investments, little bits here and there. One of the things that the Virgo report spoke about that we all see is that Manitoba is the land of pilot projects. And so one of the things that the government continues to do that we encourage them to stop doing is to continue funding new pilot projects, as opposed to finding those ones that work and then just making those permanent projects that or permanent programs that can count on their funding and therefore grow and expand. So child and youth mental health has not had the eye of the government in the way that it ought to. And so that's an issue that we keep on raising with the government. So I have regular meetings with each of the deputy ministers that are responsible for our different service areas. And in fact, I'm just in the process of sending another letter to some of the ministers to talk about the mental health issues here in Manitoba and how that the wait lists are growing during the course of the pandemic. It's an issue that we keep on raising with them. So we feel you. We know that those wait lists are massive. And so if you have specific case issues, again, please call us at the Advocacy Services Department. But then also, if you want to follow some of the stuff that we're doing at a systemic level, that is an issue that we keep on the front burner in terms of, our office's activity.
All right, thank you so much for sharing that, folks. And that is certainly, I think, from most of my colleagues, is a huge issue that we're dealing with this year is the impact of mental health on education, but like on the students, caregivers as a whole. But we are seeing concerning trends that we have never really seen before. So knowing that we have the support of your office and continuing to call and to let you folks know kind of, what some of our needs are, but also in difficult situations, just to advocate for the needs of our children and youth. That's really, really important, and kind of highlighting that systemic approach, which I think what we're seeing is not one system can do this alone, and we really do need one another, because it's the wait lists. I mean, there's no good word for that. Like, there is no way that anyone should have to wait even a month for mental health services, never mind 2 to 3 years. Like, it's disgusting and gross, and yeah, it's very upsetting. All right, so thank you so much for that question. And for everyone out there, and I know mental health is kind of the top of a lot of people's thinking right now, do reach out to the office. And I know a lot of people do, and I have certainly, advocating on behalf of the folks that I work with to just say, this is somebody that I'm working with, they need the support, they're not getting it, they're really far down on that list, but this is what's going on. That is a huge part of what the office can do to help out. And again, it doesn't mean that the person you're working with is going to get service the next day, but it does help your voice, their voice, to be heard, and things do move. So that advocacy is very important. Another question about the template, and Jason, I see you have a question. I'm coming to that right after. What if only one of the 2 bio parents sign the template? Is it still valid to use by the primary caregiver who is not the bio parent?
Yeah, so we have seen it signed just by one parent. So I'll use the example of child is living with grandma, mom signs the declaration saying, I authorize grandma to be the temporary guardian. So what we don't know in that scenario is that, what are the custody arrangements between the parents? So I think, like, for the most part, if there is another parent who wants to have care and control of that child, and parent A has given grandma care and control temporarily, and parent B is saying, like, hey, what about me? That becomes sort of a custody access matter. So, we wouldn't be wading into that too much, because the custody access situations aren't sort of something we do a lot of advocacy around specifically, but for the most part, yeah, like, it doesn't need to have both biological parents signing it in order to be valid. But of course, every scenario is different. And if there is a sort of a custody situation that's overlaying on that, then that can complicate things. I don't know if that answers your question, but yeah.
All right. Okay. And we have another question here from the Phoenix Sinclair inquiry and the recommendations made from the province. Who is following up to ensure that the child caring agencies are abiding and doing what is recommended?
So I can respond to that one. So as one of the challenges with a lot of those big inquiry reports, and it's true for the Virgo report as well as for the Phoenix Sinclair inquiry report and other reports like that, is that those reports are directed to the government, and then there isn't typically an oversight mechanism that goes along with it to ensure that those recommendations are going to be implemented. However, with respect to the Phoenix Sinclair inquiry, we did something a little bit unique last year in that we did a very extensive analysis of the Phoenix Sinclair inquiry recommendations, because we agree that it was a really critical process and inquiry for our province to look at the child welfare system and to really improve it in important ways for children and families. And so there were really important recommendations that came out of that we realized were not, many of them were not moving forward. And so last year we put out a report that detailed the lives of 19 children who died because of maltreatment causes after Phoenix's death. And so we profiled those 19 young children who had died, after the time of Phoenix, and we released a special report that I'm going to actually put in the chat function right now. I'll try to beat Jessica to it right now. She's usually pretty quick. There it is. And so one of the things that we did is, because in our legislation, the Advocate for Children and Youth Act, we are empowered to track recommendations that are made under our legislation. So while initially or originally the Phoenix Sinclair inquiry recommendations were not made under our legislation, what we did in our maltreatment report is we made a formal recommendation that the government implement the outstanding Phoenix Sinclair recommendations. And what that did is it then brought those recommendations underneath our legislation and now allows us to track them. So prior to us publishing the maltreatment report, we required from the government an extensive amount of evidence on each one of the recommendations, exactly what activities that they had undertaken, exactly what they'd done, changed, modified, implemented since those recommendations came in the 2014 inquiry report. And we put those recommendations and the government's evidence through our standing compliance process with recommendations that we make. And so in the maltreatment report that I just put into the chat function, you'll see, I think it's Appendix C in that report, there's a very detailed analysis of where, like, the status of each of the Phoenix Sinclair inquiry recommendations. And what we are now doing is tracking each of those recommendations as part of our follow-up to the maltreatment report. So that's a long response to answer your question, that our office is now going to be the one tracking what the government's doing with the Phoenix Sinclair inquiry recommendations.
All right, thank you so much. That is a really, great answer, and just having the report is fabulous. I just took a quick peek at that and it's phenomenal. Okay, we got another one here. Just wondering if your office is involved with advocacy concerns a parent may have in regards to their child's mental health.
Yes, mental health is absolutely part of our formal mandate. And so we advocate inside the mental health system all the time.
All right.
Yeah, so if a family member has, if they're saying, I'm concerned that my child isn't getting the services that they need, or I'm not sure where to go, you can definitely get in touch with us and we can help you kind of with the navigation of services as well as advocacy for services.
All right. Thank you very much. All right, folks, I'm not seeing any more questions pop up here. Oh, Mitch, I saw you had a hand up earlier on. Jessica, could you unmute Mitch Ashcroft? I saw a hand up, unless that's already been handled. I'm not sure. Oh, that was an accident, says Mitch. Okay, all good. All right. Does anybody else have any questions? No? Can we get Ainsley and Michelle's email? I believe that is...
I did put my email in the chat. It's mkowalchuk@manitobaadvocate.ca. You can also, there we go. And you can also do the info@manitobaadvocate.ca, and then it can be directed to us. Oh, the Bear Clan mural. So The Bear Clan mural is actually going on the building that they use on Selkirk Avenue, called the Bear Den. And I can't remember the address exactly, but it's in the 500 block of Selkirk. And we're actually going to be painting it on panels because they do not own the building, but the landlord has agreed to have the mural kind of like mounted on panels so that if ever they needed to move locations, they could take the mural with them. So that's where it's going to go up.
That's awesome.
And I'd also say we're always on the hunt for more walls. So if any of your schools want a beautiful mural, please get in touch with our office. And we'd love to come out and do a mural about children's rights in your school. And then you can also be part of, eventually we're going to have like a scavenger hunt for children's rights across the province, and you can be featured as part of that project.
That's great. All right, folks, if there is no more questions, I would just like to really thank both you guys, Ainsley and Michelle, for this fabulous session. Really just taking the time to break down, the services that you provide at your agency and how you can help support people. I'm always telling, the folks that we're working with, like if you're having an issue, whether it's mental health, if it's justice, we didn't talk a lot about today, but like we're seeing also a lot of issues around substance misuse and addiction supports. Again, that there's less and less of, and especially now that they're going to be falling under health and what that will look like. And just really coming to you folks to help us advocate because we're not getting a lot of the answers. So you really are there to support us, to work systemically and collaboratively. And it's really, really great. And you're there to advocate for the children and youth, which is amazing. So I just want to thank you both so much for spending the afternoon with us, and Jessica for doing all that amazing work in the background and keeping everything up and running. And again, for everybody attending, thank you so much for, prioritizing this, taking the time to educate yourselves and sharing this information. And like I always say to people too, if you don't know, call them, just call the office, and you could try to brainstorm a solution together. So thank you so very much. We are so grateful that you folks were able to spend the afternoon with us.
Thank you so much for having us. We really appreciate, you're always such a gracious host, Fiona, and always such a promoter and supporter of our office. And we're really grateful that you created the space for us. So thank you very much.
Anytime. Maybe we could talk about a mural.
We can definitely talk about a mural. For sure. Yeah, and thanks everyone on the line as well. We really appreciate you taking time to come and spend some time with us.
And for the great questions and
Yeah,
discussion. Thanks a lot, everyone.
Thank you.
Hey, thanks.